The federal government says the third wave of the spread of COVID-19 virus has not reached a threat level that warrants the imposition of a lockdown, and for that reason it is not considering another lockdown. The country is currently recording a surge in infection rate and a rise in the spread of the Delta variant. We have details in this report.
The wave of COVID-19 has hit Nigeria really hard, alongside fears of a spread of the deadly Delta variant. Already, government has stepped up campaigns advising citizens to get fully vaccinated and strictly observe safety protocols, even if they have received the 2 jabs of the COVID-19 vaccines. Yet, health authorities say the situation is not serious enough to warrant a total lockdown, which would grind economic activities to a halt.
So the non-pharmaceutical interventions, that is to say the public health measures, are still extremely important, because that is the main weapon we still have, and it works. It is something that we can rely on: wearing of masks, using sanitizers, social distancing, avoiding crowds, and also generally observing hygiene if you have a cough or a cold, and reporting when you do not feel well.
The recent cholera outbreak in some parts of the country is a cause for worry. The federal government is now looking to send chemical treatments to areas of concern to reduce the number of people drinking raw water collected from streams and other pools of water. More importantly, government is stepping up campaigns to stop open defecation and advise citizens to boil or treat water before drinking. Amid all these health concerns, the federal government is worried about doctors being on strike for the 3rd time this year. While the Minister of Health acknowledges that the resident doctors may have a genuine grievance, he appeals to them to continue talking about it instead of resorting to the option of downing tools. The contentious issue of no work, no pay is another troubling point for the doctors, but Dr. EHANIRE says it is a standard recommendation of the International Labour Organization, which the federal government will not flout. He points out that most of the doctors' grievances are with state governments and urged them to call off the nationwide strike.